Hi everyone, my name is Beth and I'm a pelvic health physiotherapist at Proactive. And today I'm going to be talking to you about Julie Wiebe's piston science. So the piston involves several different muscles, one of which is the diaphragm. The diaphragm attaches to the underside of your ribs cage through here, and it sits just underneath the ribs here. The next muscle I want to discuss is the transverse abdominis. This wraps around the entire trunk and it is part of our inner core. And then we have the pelvic floor, which sits at the bottom of the pelvis in a hammock-like shape. These three muscles work together to create stability through our inner core. So the way it works is that your diaphragm is here, our pelvic floor is down here. So as we breathe in with our diaphragm, both the diaphragm and pelvic floor lengthen and stretch gently downward. As we exhale through our mouth, there is a gentle recoil and lift back up of the pelvic floor and diaphragm together. In addition to those two muscles, the transverse abdominis, as we breathe into the diaphragm, gently lengthens and stretches, and then as we exhale, it contracts and compresses as well. So what we will often see in our patients are a couple different compensations. So we'll see things like breath holding, so a lot of kind of lifting and rib flaring in this way, and you'll see a lot of pelvic floor tension in these clients. We'll also see abdominal bracing, where they're just creating a lot of outer abdominal contraction and tension. And then we'll also see just upper abdominal overactivity without any lower abdominal or pelvic floor activity. And you can imagine how these different compensations play a large role on symptoms like leakage, prolapse, and pain. So let's talk just a little bit about how to engage your piston. So what you're going to do is you're going to start with a diaphragmatic breath. There's a couple of different ways or visuals to think about when doing this. You can put your hands on the sides of your ribs right here. As you breathe in through your nose, what should happen is your rib cage should expand laterally. So you're going to see like this. So I breathe in and out. So you see that gentle expansion and then that gentle compression of the rib cage. The other thing I want you to think about for a diaphragmatic breath is the belly. So as you breathe in, the belly should release and fill up, and then exhale, it's going to draw back in. So it looks like this. Okay, so you're trying to go for a little bit of both. You want that anterior and posterior expansion as well as that lateral expansion with your breath. Then as you exhale through your mouth, that's when you're going to think about engaging that pelvic floor, giving a little bit of extra kind of conscious awareness to those muscles. So I usually have people and cue them in a way where they're thinking about drawing and lifting a blueberry up into their pelvic floor region. And that's going to happen on your exhale. Okay, so again, you're going to inhale to take a diaphragmatic breath and lengthen the muscles. Exhale, you're going to gently squeeze and lift. But of course, with any of this, there are people who may not benefit from engaging extra kind of force in their pelvic floor or extra contraction in their pelvic floor. So that's something to get checked out by a pelvic floor therapist. But if you're looking just to connect to your pelvic floor and your inner core muscles, the piston breath is a great place to start.